Hello, my name is Ethan Fischer, and I'm a part of the Dong Research Lab, and I'm here to talk to you about STING and TLR Co-Drugs for cancer immunotherapy. But first, let's talk about tumors. The tumor microenvironment actively suppresses tumor-specific T cell activity, which allows the tumor to continue to grow while weakening the immune response in its nearby areas. Immunotherapies attempt to counter this by promoting the activation of these tumor-specific T cells and inflammatory cytokines, chemokines, and interferons. This causes the immune system to basically respond and eliminate the cancerous cells. STING and TLR agonists are some of these agents that activate the immune system's response to the tumor, hindering the growth of said tumor. STING does this by inducing interferon response and production, and TLR, toll-like receptors, do this by inducing an inflammatory response. For this study, we'll be considering the STING agonist MSA2 and TLR agonist resiquimod as seen on the right. Both of these different pathways yield an anti-tumor response separately from one another. However, the side effects of these agonists are extremely toxic when they are not directly injected into the tumor, which becomes a problem for difficult to reach and sensitive area cancers. To counter this, the STING and TLR agonists can be linked together to create a co-drug that will release both drugs within the tumor at the same time. Dr. Thomas Burke at UCI has found that combining STING agonists with TLR agonists shows a synergistic anti-tumor effect together when directly injected to the tumor of mice, which can be seen by the purple line on the graph, which indicates the overall tumor growth and shown in volume over time. And our research group has been focusing on designing and synthesizing co-drugs using MSA2 and resiquimod. The linkers that we have synthesized use the increased quantity of the glutathione and esterase enzymes found in tumors to cleave the two drugs at the same time as they enter the tumor microenvironment. The linkers themselves are shown in red with both MSA on the right and resiquimod on the left. The synthesis of the esterase linker is only 3 steps, consisting of coupling MSA to the linker, following by forming the carbonate to better couple the resiquimod in the 3rd step. The synthesis of the glutathione linker is very similar, being 3 steps of coupling MSA and resiquimod. Future goals for this project will be to create a co-drug library using different TLR and STING agonists, as well as using the unique properties of the tumor microenvironment to make more cleavable linkers. We are also currently preparing more of these co-drugs for further mice studies. Thank you for watching and for your consideration.